It's 3 a.m., and for the third time tonight, you are standing in a cold, dark bathroom, staring at the wall. You are waiting. You feel the urgency, that desperate need to go, but the stream just won't start. And when it finally does, it's weak. It's hesitant. It stops and starts, until you're left feeling like your bladder is still half full. You shuffle back to bed, cold, frustrated, and angry. You know that in 90 minutes you'll be right back in this same spot. If this sounds familiar, then you are already in a silent battle with your prostate. I have treated thousands of men just like you, men who believe this nightly misery is just a normal part of getting old. Let me be perfectly clear. It is common, but it is not normal. It's a sign that your prostate, that small walnut-sized gland you've ignored your entire life, is now controlling your life. We're going to talk about BPH, or prostate enlargement. We're going to talk about prostatitis, that agonizing inflammation. But today, we're not going to talk about surgery. We're not going to talk about pills. We are going to talk about something you do in private, something you've probably done your entire life, believing it was, at worst, harmless, or at best, a good way to relieve stress. We are going to talk about masturbation, and I am here to tell you, as a medical professional, that there are 3 critical, devastating mistakes you are likely making. Habits that are not relieving stress, but are actively worsening your condition. They are the gasoline you are pouring on the fire that is already burning in your pelvis. This isn't just a list. This is an intervention. I need you to stay with me, because the information I am about to share is not discussed by your family doctor. It is not something you talk about with your friends. And the third mistake is the most shocking of all. It's an act of hygiene that millions of men perform every single day. It's something you probably believe is clean and safe, but in reality, it is a direct chemical and bacterial assault on your prostate. It's an innocent assassin that might be sitting on your bathroom counter right now. If you truly want to stop those 3 a.m. visits to the bathroom, if you want to regain control, you cannot afford to miss a single second of this. Let's begin. First, we must understand the enemy. What is your prostate, and why is it doing this to you? Imagine your urethra, the tube that carries urine out, is a perfectly clear, wide-open garden hose. Now imagine your prostate is a clamp. When you were 20, that clamp was wide open. But as you aged, hormones like DHT caused that clamp to slowly, year after year, tighten and squeeze. That is BPH. That is why you can't start. That is why you can't finish. That is why you feel that constant nagging pressure. This isn't just an inconvenience, it's a thief. It steals your sleep, your peace of mind, and your sense of control. Now, how do your private habits make this worse? Mistake number 1, the death grip and the internal chokehold. We are all guilty of it at some point in our lives. In the pursuit of a quick, powerful release, we apply the death grip, a white knuckle, high tension, maximum pressure grip. You believe this tension is only in your hand. You are catastrophically wrong. Your body is a single connected system. When you clench your hand with that much force, you are unconsciously sending a shockwave of tension down your arm, through your abdomen, and deep into your pelvic floor. You are clenching your internal muscles, the very muscles that form a sling or a hammock around your prostate. You are, in effect, strangling your prostate from the inside. Think about it. What happens when you squeeze a muscle for a long time? It gets inflamed. It gets rigid. It screams in pain. Now imagine doing that to the muscles surrounding your prostate, day after day, year after year. You are creating a permanent state of tension. You are choking off healthy blood flow. You are trapping inflammatory fluids. This is the hidden source of chronic prostatitis. I had a patient, a 68-year-old gentleman. He had all the symptoms: the ache, the urinary pain, the pressure. We ran every test. No bacteria, no infection. We were baffled. Finally, I asked him about his private habits. He admitted with some embarrassment that he had always used this high-pressure technique. His pelvic floor was as tight as a 25-year-old bodybuilder's. He had, through decades of this one habit, literally trained his own body to strangle his own prostate. The solution is not to stop. The solution is to change. This must become an act of relaxation, not an act of tension. You must consciously breathe. You must feel those pelvic muscles and tell them to relax. Let go of the death grip, because your prostate is already being squeezed by BPH. The last thing it needs is for you to squeeze it from the inside, too. I have a question for you, and I want you to be honest in the comments below. Have you ever felt that tightness, that dull, unexplained ache in your pelvis, even when you're just sitting? Perhaps you've just discovered why. Let me know. So, you've learned to relax your grip. You've solved the first problem. But what if I told you the pause between sessions, or the lack of them, could be just as damaging? This leads us to the silent ticking time bomb. Mistake number 2, the congestion paradox. This is a two-sided coin, and both sides are poison for your prostate. On one side, you have men, especially as they age, who stop all activity. Libido wanes, or perhaps they simply believe it's better to abstain. They go weeks or even months without ejaculating. This is a terrible mistake. Your prostate is a gland. Its job is to produce. It is constantly creating prostatic fluid. This fluid is meant to be expelled. Think of your prostate as a small lake. If fresh water flows in and out, the lake is clean and healthy. But what happens if you dam the river? The water becomes stagnant. It becomes thick. It becomes a toxic, sludgy breeding ground for bacteria. This is exactly what happens in your prostate. It's called prostatic congestion. When you don't clear the pipes, that stagnant fluid builds up, it thickens, and it inflames the prostate from within. Worse, the minerals in that old fluid can crystallize, forming tiny, sharp prostate stones that cause chronic pain and blockage. A groundbreaking Harvard study showed that men who ejaculated 21 or more times per month had a significantly lower risk of prostate cancer. Why? They were flushing the system. They were cleaning out the pipes. But this coin has another, darker side. This is the side of overstimulation. Driven by the internet, there is a modern habit called edging, or orgasm denial. This is the practice of stimulating yourself for 30 minutes, an hour, or even longer, bringing yourself to the very brink of release and then stopping, over and over. From a urological standpoint, this is pure insanity. Here is what you are doing. When you are aroused, your prostate becomes engorged with blood. It swells up, ready for the final propulsive release. When you deny your body that release, you are trapping that blood. You are holding your prostate in a state of maximum, unnatural, swollen tension. It's like revving a car engine to 8,000 RPMs while in neutral. You are overheating the engine. You are, quite literally, cooking your prostate in its own blood-filled inflammatory soup. This is congestive prostatitis. You're not just making it last longer. You are damaging the tissue. The solution is balance. The goal is not an endurance test. The goal is not a drought. The goal is a healthy, regular, natural release. When your body is ready, let it finish. Allow the system to reset. You have now learned how to do it, and how often. But none of it matters. Absolutely none. If you make this final, critical mistake, the one I warned you about, the one that turns a harmless act of hygiene into a direct chemical invitation for a medical emergency, we have arrived at the most important part of this video. Mistake number 3, the innocent assassin. You're in the bathroom. You decide to use a lubricant to make things easier or to clean up. What do you reach for? The bar of soap? The squirt of shower gel? The shampoo? Or perhaps the most natural lubricant of all, saliva? As a urologist, I am begging you, stop this. Now, you are committing a catastrophic 2-part assault on your own body. Part 1, the chemical burn. That soap, that shower gel, that shampoo, they are not gentle. They are detergents. They are highly alkaline. Their entire purpose is to strip oils and kill everything. Your skin has a natural protective acid mantle. The skin of your penis, and especially the opening of your urethra, is the most delicate, sensitive tissue on your body. When you apply these harsh detergents, you are not cleaning. You are chemically burning that tissue. You are stripping the armor off your urethra, creating microscopic bleeding cracks and fissures. You have just, in an act of hygiene, created a raw, open, undefended wound at the very gateway to your bladder. And that is when Part 2 begins. The bacterial invasion. You've just destroyed the defenses. Now, you introduce the invaders. Let's talk about saliva. Your mouth is one of the most bacteria-filled places on the human body. It is a jungle of billions of organisms. E. coli, Staphylococcus, Streptococcus. When you use saliva as a lubricant, you are performing a direct bacterial inoculation. You are taking a bacterial bomb and placing it directly onto the raw, open wound you just created with the soap. These bacteria, they don't stay at the tip. They ascend. This is called a retrograde infection. They travel up the urethra against the flow of urine. And where is their first stop? Where do they find a warm, nutrient-rich, dark place to breed? Your prostate. This is how acute bacterial prostatitis begins. And let me tell you, this is not a dull ache. This is a 5-alarm fire. This is a 104-degree fever. This is body-shaking chills. This is an agonizing, burning pain so severe you cannot pass a single drop of urine. This is a trip to the emergency room. This is a week in the hospital on intravenous antibiotics. And it all started with a pump of soap and a drop of saliva. The same goes for hand lotions. Petroleum jelly. They are not water-soluble. They trap bacteria. They clog the ducts. The solution is non-negotiable. First, wash your hands with soap and water before you ever touch yourself. Second, if you must use a lubricant, there is one choice. A high-quality, water-based, sterile lubricant from a pharmacy. It must be free of parabens, glycerin, and all fragrances. It is the only thing that is safe. I've just shared the 3 physical mistakes, but I have saved one bonus mistake for last. Because you can fix all 3 of these, but if you don't fix this one mental mistake, you will never truly heal. The bonus mistake, the mind-prostate connection. For many men, especially from an older generation, this act is surrounded by a lifetime of guilt, of shame, of anxiety. You feel it's wrong, dirty, or a weakness. As a doctor, I can tell you, that guilt is a physical act. When your brain feels shame or stress, it floods your body with cortisol. It triggers your fight or flight response. And where does a man unconsciously hold his stress? His jaw, his shoulders, and his pelvic floor. That's right, the exact same tension from the death grip. You are causing it with your mind. You are unconsciously clenching your pelvic floor all day long because you are trapped in a feedback loop of stress and guilt. Your mind is putting your prostate in a chokehold. Part of healing your prostate is giving yourself permission to relax. To understand this is a normal, biological function. Let go of the guilt. You will, in turn, let go of the tension. A relaxed mind is the only thing that can lead to a relaxed pelvic floor. So, where do we go from here? This knowledge is not meant to scare you. It is meant to empower you. You now know what to do. 1. Release the death grip. Practice relaxation. 2. Find the balance. No more droughts, no more marathons, just a healthy, regular rhythm. 3. Stop the chemical assault. Clean hands and only water-based sterile lubricant. And 4. Release the mind. Let go of the guilt that is physically tensing your body. These changes, combined with a healthy diet, good hydration, and walking, this is how you take back control. This is how you stop letting your prostate dictate your life. This is how you finally sleep through the night. I have a question for you, and I want you to be honest in the comments. Of these 4 mistakes, the grip, the frequency, the chemical, or the mind, which one was your aha moment? Which one did you not realize you were doing? Share your story below. Your comment might just help another man who is suffering in silence. I must end with this. I am a urologist, but I am not your urologist. This video is education, not medical advice. If you have the symptoms I described, the weak stream, the nightly visits, the pain, Your first call is to your doctor. You must get checked. An early diagnosis is the key. If you are ready to take back control of your health, if you are tired of being a slave to your bladder, then please subscribe to Well Web. We are here to give you the truth. Your health is worth fighting for. Take care of your prostate.